Hi everyone, it's time to talk colon cancer. Today we're going to be talking about family history. And I know this is a little bit of a complicated subject because it's not something that really comes up at the dinner table or at your family picnics, but it's really important. So, as I'm sure you're all aware, colon cancer is preventable, and it's really important to get screening so that we can prevent colon cancer from happening. But it's important to know your family history because if you have one, you might need to be screened sooner or more frequently than if you didn't have one. And if you have a family history, so if you have one first-degree relative, meaning parent or sibling with colon cancer, you're at double the risk of the general population of having colon cancer. If you have more than one relative, not just first degree, but even grandparents, aunts, uncles, if there's more than one person in your family with colon cancer, you have 4 times the risk of getting colon cancer than the general population. And if you have a family member who was diagnosed with colon cancer before the age of 45, you also have 4 times the risk. So as you can see, knowing your family history really matters because it changes your risk and it changes how frequently and at what time frame you need to have your screening. The other reason that it's important is there are some hereditary colon cancer syndromes, meaning syndromes where a particular gene mutation is passed down in a family and it increases your risk of getting cancer. Now, some of these syndromes have other types of cancers that people wouldn't even think are related. So for instance, Lynch syndrome, which is one of the most common causes of hereditary colon cancer, has ovarian cancer, uterine cancer, even breast cancer associated with it. And many people wouldn't think to know that that could increase your risk of colon cancer. So that's why it's so important to ask your family about all cancers, not just colon cancers, and to bring that information to your doctor, because we don't expect you to know that. We don't expect you to realize that's an issue, but you need to gather the information and bring it to your doctor. And the more family members you have with colon cancer or any Lynch-related cancer, and the earlier age at which they're diagnosed, increases the risk that you could have one of those syndromes, such as Lynch syndrome. So, the next time you're at a family dinner or out doing a family barbecue, make sure to ask your family about cancers. Just doesn't have to be, a difficult conversation. Just say, hey, what did Grandpa Al die from? What did Aunt Louise die from? Get the information so you can be empowered and you can tell your doctor and you can get screened appropriately so we don't have to have anybody else getting a preventable cancer. Thanks.